L-Carnitine. What are the benefits for men on TRT? Then what is the dosing and should they take it orally versus injectable form?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Okay, so let's get something straight here. We're talking about L-Car, L-Carnitine, right? L-Car, because there is an L-Car, A-L-C-A-R. That's acetyl L-Carnitine. We're talking about L-Car, okay? But they're different. All right, so as a boarded nutritionist and sports nutritionist, depends on what you read. Again, you read the conventional literature on nutrition. They say that there's no real scientific evidence that L-carnitine does much for you because it's prevalent in the diet. Eat meat and eat dairy, you're going to get enough L-carnitine. Body makes it do in the liver. But I'm going to approach this from the International Society of Sports Nutrition, what they say about it. I'm going to approach it from what Dr. Michael Colgan, famous Canadian exercise physiologist, about it, and also Dr. Adkins, the guy that died not too long ago. These people use it and they publish it. I have their manuals, I have their journals. So I'm gonna err on the side of there is some efficacy for it as per their books and their research. First of all, L-carnitine, as we know, facilitates free fatty acid transport across the mitochondrial membrane for beta oxidation. We all learned that in our biochemistry class. Again, it facilitates free fatty acid transport across the mitochondrial membrane for beta oxidation. So in essence, it sounds like, boy, it'd be a good element or good to help burn fat, maybe move fat, repartitioning. And Dr. Adkins, in his book, his mnemonic, when he came to L-carnitine, he said, the fat mover. Remember this as the fat mover. It moves fat. So he used it excessively in his clinic. I think his clinic was in California or West somewhere, before he perished. Maybe it's in New York. He used it a lot, at 2 to 4 grams per day. 2 to 4 grams per day, he thought was a good dose to help move fat, mobilize fat, burn fat, be a repartition. Dr. Colgan also agreed. He uses 2 to 4 grams of L-carnitine per day as a fat mover, a burn fat. The IFSN, who is the premier researching agent, at least in America, International Society of Sports Nutrition, they publish a lot of research, and in their manuals, they say that a lot of research is equivocal. Some studies show it works, some show it doesn't. But for every study that showed that worked, they had a study that showed it didn't work. But what I found recently in their research at ISSN was that just like creatine works better when you ingest it with carbohydrate, they found that L-carnitine works better as a repartitioning fat mobilizer when consumed with carbohydrate. Something fairly new. It has been on for a few years, but that's new in literature. So if you want to augment or potentiate your use of L-carnitine at 2 to 4 grams per day, I would recommend you do with some carbohydrate because it helps get L-carnitine into the muscle cell, just like creatine. Now you mentioned you mentioned what method? Well, I'm more familiar with oral forms, all kinds of oral tablets and oral capsules. We know now that there are injectable IM routes of L-carnitine. It's put in some mixture, with biamino mix or use lipomino mixes for fat mobilization, along with methionine, inositol, choline, the thrones of L-carnitine. I just find that the amounts of carnitine that are in the injectables isn't enough. So even though you may do that and think you're getting enough in your injectable form, I always recommend you do more of the oral form to get up to that 2 to 4 grams per day. Well, let me finish up, Stephen. In my travels through all the world and seeing this stuff, L-Carnitine is used a lot throughout the world. I don't know how you guys use it there, but I mean it's used globally for cardiovascular disease, hyperlipidemia, chronic renal failure, Ray's syndrome, infertility, mitral valve prolapse, hyperthyroidism, ADHD, and ED. Now, since I have seen it work to get better ratios, a lipid profile, I have seen that work. 2 to 4 grams a day. I have seen it lower triglycerides, lower total cholesterol, and increase HDL. That's a nice thing. But also, since I have 5,000 men I've treated for ED, I will say that 2 grams per day of L-Carnitine, and I say acetyl L-Carnitine, getting off the subject, but ED men right here, 2 grams a day of L-Car, plus 2 grams of propionyl L-Carnitine. Acetyl L-Carnitine, 2 grams. Propionyl carnitine, 2 grams per day. It augments erectile function and massively potentiates PDE5Is. If your Viagra or Cialis isn't working properly, if you go on the 2 grams of propionyl L-Carnitine, 2 grams of acetyl L-Carnitine per day, it can greatly improve your erectile function. I've seen it work. The only downside is that carnitines can be expensive. They're not cheap supplements. And also it could take you several months of doing that regimen before you notice a difference in your erectile function. Yes, it works. The downside is it can be expensive and it can take months.
Okay, great, thanks. And now do this next. Click on one of these thumbnails to learn a ton more about TRT and hormone optimization.